Salina Regional Health Center is looking forward to performing its first TAVR procedure. What is a TAVR procedure? Cardiothoracic Surgeon Dr. Richard Toon and Cardiologist Dr. David Battin join me to explain. Doctors, thank you so much for being on the show. Dr. Toon, we wanted to start out with you talking about, cardiac valve disease, which is what we're going to be discussing. So what is cardiac valve disease and what are you currently doing for valves?
Currently for aortic stenosis, which is blockage of the aortic valve, which is the most common disease of the aortic valve, we have always opened up the chest. Since the 1960s, it's required an open heart procedure with full pump, operating room, and opening up a patient's chest. And generally those patients are in the hospital at least a week after surgery and of course then have a prolonged recovery. With this newer procedure, the TAVR, the recovery is much quicker and patients are up and around in no time.
Which leads us to you, Dr. Battin, to discuss the TAVR.
The TAVR is, I think, the most logical and predictable iterative step in Salina and Salina Regional Health Center. It is a minimally invasive procedure where we're able to put a similar type of valve, and instead of a major incision through the chest, we're able to insert it through a hole in the groin artery most of the time. And so that does allow for a lot earlier recovery for patients.
And so what is the procedure? How is it done in the heart then?
So the TAVR, as we've been referring to, is a transcatheter aortic valve replacement. We're able to take the valve and now this meticulously hand-sewn and handcrafted valve is crimped down or compressed and placed into a delivery system that we then take over a wire to the heart at the level of the aortic valve, and instead of obviously taking that out, we're just pushing it out of the way. And that's it in a nutshell.
So if somebody currently has heart disease, valve disease, how do they know if they would be a candidate for the TAVR procedure?
Along with this procedure comes the initiation of a heart valve clinic, where we evaluate all these patients in a very systematic process, and we see the patients as a team, including myself and Dr. Toon. And then we would have a discussion with the patient, taking into account all of their different risk factors and deciding with them what the best procedure was moving forward.
You talked about the team. Let's talk about the team in the operating room when you're performing it.
It's a large team in the operating room. Dr. Toon and myself would both be there implanting. We'd obviously have anesthesia, and we'd have another cardiologist that would help with the imaging, usually with an ultrasound.
Well, thank you so much for being on the show. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.